Every single night, more than 60 million adults over the age of 50 climb into bed carrying a quiet, invisible burden. Their arteries are stiffening. Their livers are struggling to clear the day's load. Their joints are inflamed from the inside out. And their digestive system is running on empty, unable to repair the damage that accumulated through the day. Not occasionally, not sometimes, every single night. And the overwhelming majority of them have absolutely no idea that one of the most powerful interventions ever documented in clinical nutrition is sitting in their kitchen cabinet, costing them less than the price of a single cup of coffee per serving. What if there is something extraordinarily simple that, taken consistently before bed, can lower inflammation, support liver detoxification, soften arterial walls, lubricate joints, and quietly transform the way the body repairs itself overnight? There is. And it is not a supplement. It is not a prescription. It is not sold in pharmacies. It is a single tablespoon of high-quality extra virgin olive oil consumed at night, and the science behind it is far more robust than most physicians will ever tell their patients. This is Dr. Waterling, and what is about to be shared comes from 15 years of clinical practice, watching patients dismissed by a healthcare system that profits from chronic illness rather than resolution. The system makes money when you stay sick. It does not make money when a person discovers that a $1 nightly habit can do what 12 medications cannot. So before going one sentence further, subscribe to Dr. Waterling right now and hit that like button. The channel is building toward 1,000 subscribers on a single principle: that ordinary people deserve real information, delivered honestly, without the filter of pharmaceutical marketing budgets. Every subscriber moves this mission forward. Now, the question that must be addressed first: why has nobody in a white coat sat the patient down and explained any of this? The answer is uncomfortable, but it is simple. There is no billing code for teaching a person about olive oil. There is no pharmaceutical representative bringing lunch to the clinic to promote the Mediterranean pantry. A 12-minute office visit cannot accommodate a conversation about polyphenols, oleocanthal, and the lymphatic clearance that happens during deep sleep. And so the conversation never happens. The patient leaves with a prescription, and the olive oil sits in the kitchen used only occasionally on a salad, while its full potential goes completely untapped. Here is what is actually happening inside the body during sleep, and why the timing of olive oil matters more than almost anyone realizes. Between roughly 10 p.m. and 2 a.m., the liver enters its most active phase of detoxification. During this window, hepatocytes, the working cells of the liver, are processing accumulated toxins, regenerating bile, and breaking down fat-soluble waste. This is not folk wisdom. This is established chronobiology, documented in peer-reviewed hepatology research. The liver does not work on a uniform 24-hour schedule. It has peak phases, and the late evening into early morning is when it does its heaviest work. At roughly the same time, between 2 a.m. and 4 a.m., the gallbladder reaches its highest contractile activity. The gallbladder is a small pear-shaped organ tucked beneath the right side of the liver, and its job is to store and release bile. Bile is the body's primary tool for emulsifying fats and clearing cholesterol from circulation. When the gallbladder contracts, it pushes bile into the small intestine, where the bile carries waste out of the body and pulls cholesterol along with it. If the gallbladder sits stagnant, bile thickens. When bile thickens, it forms sludge. When sludge persists, it forms stones. And 1 in 4 adults over the age of 60 already has gallstones, most of them completely unaware. Here is where olive oil enters the picture in a way that almost no general practitioner will ever explain. When approximately 15 milliliters of extra virgin olive oil, which is roughly 1 tablespoon, reaches the small intestine, it triggers the release of a hormone called cholecystokinin. The body produces this hormone specifically in response to dietary fat in the upper small intestine. Cholecystokinin sends a chemical signal directly to the gallbladder, instructing it to contract and release stored bile. This is not theory. This is documented gastrointestinal physiology, taught in every medical school in the world. The implication is enormous. A single tablespoon of olive oil, taken at the right time, mechanically flushes the gallbladder and supports the liver's overnight detoxification cycle. But the story does not end there. Extra virgin olive oil contains a compound called oleocanthal. Oleocanthal is a natural anti-inflammatory phenolic compound, and its action in the body is remarkable. Research published in the journal Nature in 2005, and subsequently confirmed by multiple independent studies, demonstrated that oleocanthal inhibits the same inflammatory enzymes, COX-1 and COX-2, that ibuprofen targets. The mechanism is comparable. The difference is that oleocanthal acts gently, continuously, and without the gastric erosion that long-term ibuprofen use produces. A person who consumes 1 tablespoon of high-quality extra virgin olive oil daily ingests roughly the anti-inflammatory equivalent of 1/10 of an adult dose of ibuprofen. Over a year, this represents a meaningful, sustained reduction in systemic inflammation, the silent driver of arterial disease, joint degeneration, and accelerated aging. Now, the most important thing the audience needs to hear right now. This anti-inflammatory effect is not equally distributed across the day. Inflammation peaks during sleep. The body's cortisol levels, which naturally suppress inflammation, drop in the early morning hours. This is why arthritis sufferers wake up with the stiffest joints. This is why cardiovascular events disproportionately occur in the early morning. This is why people with chronic inflammation often report feeling worse upon waking than they did the night before. Taking olive oil before bed places its anti-inflammatory polyphenols into circulation precisely during the body's most vulnerable inflammatory window. There is more. Olive oil's oleic acid, which makes up roughly 70 to 80% of its fatty acid content, has been shown to integrate into cell membranes throughout the body. This is not a quick metabolic event. The integration happens over weeks and months of consistent intake. As oleic acid replaces more rigid saturated and trans fats in cell membranes, the membranes become more flexible. More flexible membranes mean better receptor function, better insulin sensitivity, improved hormone signaling, and softer arterial walls. A meta-analysis published in the journal Lipids in Health and Disease confirmed that consistent extra virgin olive oil consumption reduces LDL cholesterol by an average of 8 to 12% and improves arterial elasticity measurably within 6 to 8 weeks. So here is the painful question. Why does conventional medicine not lead with this? Why does the cardiologist hand out a statin prescription before recommending a tablespoon of olive oil at night? Because the system you rely on for health is not built to make you well. It is built to manage you when you are sick. There is no profit in a kitchen ingredient. There is no patent on olive oil. There is no pharmaceutical sales representative waiting in the cardiologist's office to remind her, between patients, that the Mediterranean cohort studies have produced some of the most consistent cardiovascular outcomes ever documented in medical literature. The information exists. The studies are published. The biology is established. But the conversation does not happen because there is no financial mechanism to drive it. Consider the case of Margaret, a 62-year-old retired schoolteacher who came into the clinic complaining of joint stiffness that woke her every morning at 5 a.m. Elevated LDL cholesterol of 168 milligrams per deciliter, persistent constipation, and a fatty liver diagnosis from her last ultrasound. She had been told by her primary care doctor that she needed a statin, a stool softener, and possibly a referral to a hepatologist if her liver enzymes continued to climb. She had tried the standard advice. Cut saturated fat, walk more, drink more water. None of it had moved the numbers in 3 years. She was discouraged, frustrated, and convinced her body was simply failing her. The intervention was almost embarrassingly simple. 1 tablespoon of high-quality extra virgin olive oil, taken roughly 30 minutes before bed every night without exception, combined with a small adjustment in dinner timing, finishing her last meal by 7 p.m. instead of 9 p.m. That was the protocol. No supplements, no medications, no expensive equipment. Within 3 weeks, Margaret reported that her morning stiffness had decreased by roughly half. Within 6 weeks, her bowel function had normalized completely. At her 3-month follow-up, her LDL cholesterol had dropped to 142. At 6 months, it was 128, and her liver enzymes were within normal range for the first time in 4 years. She did not need the statin. She did not need the referral. What she needed was information that nobody had thought to give her. Now here is exactly how to do this correctly, because the details matter enormously and most people get them wrong. The first question is which olive oil to use, because this is where the entire protocol succeeds or fails. The oil must be extra virgin, cold-pressed, and ideally certified within the last 12 months from harvest. Look for a harvest date on the bottle, not just a Best Buy date. The harvest date tells the truth. Oil more than 18 months from harvest has lost the majority of its oleocanthal and polyphenol content, regardless of how it is stored. The bottle must be dark glass, never clear plastic, because light degrades the polyphenols rapidly. The country of origin should be specified, not vague phrasing like imported from Mediterranean countries, which often masks bulk blended low-quality oil. Spanish, Greek, Italian, Tunisian, and Californian single-source extra virgin oils tend to provide the most reliable polyphenol concentrations. Expect to pay $15 to $25 for a 500 milliliter bottle of genuine high polyphenol oil. If the price is dramatically lower, the product is almost certainly adulterated. Here is a simple test that can be performed at home. Place a tablespoon of the oil in the mouth and hold it for a moment. Genuine high polyphenol extra virgin olive oil produces a distinct peppery sensation at the back of the throat, sometimes intense enough to cause a slight cough. This sensation is the oleocanthal. If the oil is smooth and buttery with no peppery bite, the polyphenol content is low. The cough is the medicine. The protocol itself is precise. Approximately 30 to 45 minutes before bed, on a relatively empty stomach, meaning at least 2 hours after the last meal, consume exactly 1 tablespoon, which is approximately 15 milliliters, of the extra virgin olive oil. Take it straight, or combine it with a teaspoon of fresh squeezed lemon juice to ease the taste and add additional liver-supportive compounds. The lemon juice is optional. The olive oil is not. Sip approximately 200 milliliters, which is roughly 1 cup, of room temperature water afterward. Not cold water. Cold liquids contract the upper digestive tract and reduce the gallbladder stimulation response. Room temperature or slightly warm water allows the digestive system to remain relaxed and receptive. Then go to bed within 45 minutes. The reason for this is mechanical. Lying down allows gravity to assist the oil's movement through the upper digestive tract and into the small intestine, where the cholecystokinin response occurs. Standing or sitting upright for hours after consumption diminishes the effect. For the first week, expect some adjustment. Some people experience slightly looser bowel movements in the morning. This is normal and reflects the gallbladder beginning to release accumulated stagnant bile. This effect typically normalizes within 7 to 10 days as the system recalibrates. If the loose bowels persist beyond 2 weeks, reduce the dose to 2 teaspoons rather than 1 tablespoon for an additional week before returning to the full dose. Now, the implementation framework. Here is the complete weekly schedule, broken down so there is no ambiguity about what to do or when. Week 1 focuses entirely on consistency. The goal is not optimization. The goal is simply taking the tablespoon every single night at the same approximate time for 7 consecutive nights. The body must establish the rhythm. Most people who fail this protocol fail in the first week because they take it twice, skip a night, take it 3 more times, skip 2 nights, and then conclude it does not work. Consistency is the medicine. Set a phone reminder for 30 minutes before the intended bedtime. Place the bottle and a measuring spoon on the kitchen counter where they cannot be ignored. Do not rely on memory. Build the environmental cue. Week 2 introduces the timing refinement. Begin finishing dinner by 7 p.m., or at least 3 hours before bed. This creates the empty stomach window that maximizes the cholecystokinin response. If the schedule does not permit early dinner, at minimum ensure no snacking after the evening meal. The fasting window before the olive oil dose matters more than the absolute dinner time. Week 3 adds the morning observation phase. Pay attention to morning bowel function. A healthy response includes 1 or 2 well-formed bowel movements within an hour of waking. Pay attention to morning joint stiffness. Many people notice a measurable reduction in stiffness within 14 to 21 days. Pay attention to skin texture, particularly on the hands and face. Increased oleic acid intake produces a subtle but observable improvement in skin pliability and hydration within 3 to 4 weeks. Week 4 through week 8 focuses on consolidation. By this point, the habit is established, the body has adjusted, and the cumulative effects begin to compound. This is also when measurable changes appear in laboratory markers if a baseline was taken. For those who have access to lipid panels, expect noticeable LDL improvement by week 8, with continuing improvement through week 12. For those tracking blood pressure, expect modest but consistent reductions of 3 to 7 millimeters of mercury in systolic readings. By month 3, most people have either fully integrated the protocol into their life or abandoned it. There is rarely a middle ground. Those who maintain it report cumulative benefits that continue developing for many months. Improved sleep quality, reduced joint pain, clearer skin, more regular digestion, better lipid profiles, and a generally improved sense of physical resilience. Now, the critical warnings that must be addressed honestly because no responsible clinician would discuss this protocol without them. This protocol is not appropriate for everyone. Anyone with known gallstones must speak with a physician before starting. The increased gallbladder contraction stimulated by olive oil can mobilize an existing stone, and a stone lodged in the bile duct is a medical emergency. The symptoms of a stuck stone include severe pain in the upper right abdomen, often radiating to the right shoulder blade, along with nausea, vomiting, and sometimes fever. If any of these occur during this protocol, call emergency services immediately. Do not wait. Do not drive. Call for emergency transport. This is not a situation to manage at home. Anyone taking blood-thinning medications, including warfarin, apixaban, or even daily aspirin, should discuss this protocol with the prescribing physician before starting. Olive oil's polyphenols have mild antiplatelet effects, which means they may enhance the effect of these medications. This is not a reason to avoid olive oil. It is a reason to coordinate with the prescriber so that dosages can be monitored appropriately. Never discontinue prescribed medications based on anything in this video. Olive oil works alongside medical treatment, not as a replacement for it. Anyone with diagnosed pancreatic disease, particularly chronic pancreatitis or recent acute pancreatitis, should not begin this protocol without explicit medical guidance. The cholecystokinin response that drives gallbladder contraction also stimulates pancreatic enzyme release, and a compromised pancreas may not tolerate this stimulation well. Anyone experiencing unexplained abdominal pain, persistent indigestion, unintentional weight loss, or yellowing of the skin or eyes should see a physician promptly before starting any new protocol. These symptoms can indicate serious conditions requiring proper diagnostic evaluation, not home-based intervention. The protocol described today supports the body's own physiological processes. It does not replace medical evaluation when something requires clinical examination. The goal is not to abandon the healthcare system. The goal is to participate in one's own health with knowledge and intention, rather than as a passive recipient of fragmented advice. Now, a question worth asking everyone watching this. How old are you? Write the age in the comments. The channel needs to see which age group makes up the majority of the audience because that information directly shapes which topics get covered in future videos. The 50-year-old, the 60-year-old, the 70-year-old, the 80-year-old each have different priorities and different physiological realities, and the content needs to reflect that. So leave the number. It takes 3 seconds and it genuinely shapes the work that follows. A final consideration that deserves direct attention. The body is not broken. The aging process is not a verdict. The stiffness in the joints, the sluggish digestion, the climbing cholesterol numbers, the morning fatigue, these are not inevitable consequences of getting older. They are signals. They are the body's way of communicating that something fundamental is missing. And very often what is missing is exactly the kind of consistent, low-intensity daily support that a tablespoon of high-quality olive oil provides. Modern life stripped this from the daily routine of most people in the developed world. Mediterranean populations who maintained this practice across generations have produced some of the most consistently favorable longevity outcomes in the history of nutritional epidemiology. The information is not new. The neglect is, there is no expensive equipment required. There is no membership to purchase. There is no app to download. There is one bottle of carefully chosen olive oil, 1 tablespoon, 1 quiet moment before bed, and the willingness to do the same small thing every night for the next 3 months. That is the entire intervention. That is the protocol that has, in clinical practice, moved patients off statins, restored normal bowel function in those who had given up hope, softened arthritic joints that had been stiff for a decade, and given people back a sense that their bodies are still capable of repair. If this information was useful, send this video to someone who needs it. A parent, a spouse, a friend who has been complaining about morning stiffness and elevated cholesterol and digestion that no longer works the way it once did. A single tablespoon every night for 3 months. That might be the thing that gives them back a piece of their health that they had quietly accepted was gone forever. Subscribe to Dr. Waterling. Hit the like button. The mission is to get real, honest, clinically grounded information to the people who have been failed by a system that profits from their continued illness. Every subscriber, every like, every comment, every share moves that mission forward. The work continues with the next video. Until then, take care of the body that is carrying you through this life. It is the only one available, and it responds, often dramatically, to even the smallest acts of consistent care. This is a sensitive area of personal health, and if any of the symptoms or conditions discussed today apply personally and feel urgent or concerning, please reach out to a trusted physician for evaluation. The information here is educational. The decisions belong to each individual, made in partnership with the clinicians who know the personal medical history. The goal is empowerment, not isolation from professional care. Both have their place. Both matter. Good night. And 1 tablespoon at a time, the body will begin to remember what it is capable of.